Hello. My name is Matt Langen, and I'm the co-founder of DigiDoctor. 5 years ago, I dealt with chronic abdominal pain, and it took me 2 years in seeing 11 different providers before I figured out what was causing that pain. And this may not be any surprise to you at all. And it's probably something that you can resonate with, either as a patient yourself or knowing another patient in your family. 2/3 of the patients are dissatisfied with the care that they receive. And the number one reason that they're dissatisfied is because of poor communication with their provider. And if you dig deeper into the numbers, it makes sense. It's not startling. After all, patients see a doctor 3 times each year for an average of 18 minutes at a time. Now, this is the most static and transactional relationship, I believe, in any industry. And that's why we created DigiDoctor. At DigiDoctor, we focus on the 99.9% of time that patients are not actually seeing their provider. Understanding that during that time, patients are making decisions that ultimately impact their health. DigiDoctor is patient relationship management and marketing automation software for doctors, dentists, and other healthcare professionals. What that means is that we reach out in between appointments, before appointments and in between appointments, to prepare patients for their upcoming appointments, and then to follow up with them to monitor their progress, survey their satisfaction, and recommend products and services to patients based on information that's unique to them, such as their medications, their conditions, their age, their appointment types, when they last came in, and much, much more. Now, the overarching purpose of this is to improve the patient experience, to collect more information from a patient so that the doctor has a more robust understanding of what's going on so they can make more efficient use of their time once they meet face-to-face. But also, well, as a result, the main purpose, because the customer is our doctor, is to grow the medical practice and reduce medical malpractice risk for physicians. Our business model is a software as a service play. It's a web-based technology that is HIPAA compliant. We charge right now $250 per provider per month. And speaking of providers, we've identified 3 segments in our target market based on the value that they perceive DigiDoctor brings to the table. The first are those who view DigiDoctor as a marketing tool for them. These end up being practices that are in the chiropractic or the aesthetic space, and they are actively trying to recruit more patients, also known as customers for these practices. It's also a tool that they can use in order to recommend products and services to patients based on what they've historically come in for, or based on things that they've been interested in on their website by filling out lead forms. Secondly, as a risk reduction tool for providers that are high risk for being sued for medical malpractice, such as neurosurgeons or really surgeons of any type. DigiDoctor is terrific in order to manage expectations, improve compliance, but also every single message that we send out, as well as when we send it out, and if it's received, is logged by our software. So we create a paper trail that a provider can use in the event of being sued. And finally, as a readmission reduction tool for hospitals, with the recent Affordable Care Act, the hospitals are being dinged if patients are readmitted within 30 days of being discharged. So if we can follow up with patients post-discharge to understand how they're progressing, and if their condition starts getting worse, we can flag them so a provider can proactively refer them elsewhere. Now let's talk about traction. 3 years ago, I started blogging about this because I thought that there was a need. And over this time, I've collected over 700 leads who have requested demos, downloaded white papers that I've written, or just requested for more information. So it was quite phenomenal, the feedback that I was getting. And we actually now have a bug-free minimum viable product, which in this space is actually quite an accomplishment. Healthcare is extremely difficult to create a piece of software it's got to be robust. It's got to make sense for a lot of different patient types. and it's got to be HIPAA compliant. And we also have one paying customer. It's in the chiropractic space, and we're loading in another practice in the orthopedic space right now. In closing, we're the guys to do it. Thank you very much for your time.